Hello everyone, and thank you for the opportunity to speak today about our work looking into the risk factors for food contamination among children aged 6 to 59 months discharged from community management of acute malnutrition programs for severe acute malnutrition in Awal East, South Sudan. This was a project in collaboration with London School of Hygiene and Tropical Medicine, Ministry of Health South Sudan, and Action Against Hunger. So 13.6 million children under the age of 5 suffered from severe acute malnutrition in 2020. And in South Sudan alone, 300,000 children under the age of 5 suffered from SAM. Relapse to SAM or MAM after treatment is poorly understood, with one study estimating relapse ranged from 0 to 37%. The risk factors for relapse are also poorly understood, but diarrheal disease has been suggested as one of the key risk factors for relapse. Foodborne disease is one of the major causes of diarrheal disease, with foodborne diseases causing over 600 million cases and 420,000 deaths globally. And in East Africa, Salmonella, cholera, and toxigenic E. coli are three of the diarrheogenic foodborne diseases responsible for the greatest loss of DALYs. And studies in low and middle income countries have found that child foods are contaminated with high levels of microbes, including E. coli. On the right, we can see how food can become contaminated through either contaminated fluids, floors, flies, fomites, or fingers, and these are contaminated by infected host. And then through fecal oral transmission, the new host becomes infected and can either present diarrheal disease or other symptoms, as well as asymptomatic infection. Some of the risk factors suggested for foodborne diseases have been found to include hand washing or poor hand washing with soap practices, as well as poor storage practices, cooking practices, and animal contact within the household. The objectives of this study was to determine the prevalence of child food contamination, defined as the prevalence and count of E. coli and total fecal coliforms, to determine the critical control points within the food preparation and feeding of the child, and suggest feasible control measures, and to investigate the factors including food preparation, hygiene practices, and animal contact that may be risk factors for child food contamination. Combining qualitative and quantitative data will help us provide the necessary data to build appropriate interventions for this currently understudied field, which includes children that have recovered from severe acute malnutrition, as well as in humanitarian settings. So this study is an exploratory cross-sectional study, which was nested within a multi-country prospective cohort study of children recovered from severe acute malnutrition in South Sudan, Somalia, and Mali. We conducted 600 household surveys, as well as 200 structured observations within these households, which looked into how food was prepared, cooked, fed, and stored, as well as animal contact in the feeding and food preparation areas. And also within these 200 households, food samples were collected and analysed for total fecal coliforms and E. coli. Using the structured observations, we were able to produce food flow diagrams, which helped us to look at food safety and analyse the food product information. And also using the household surveys and the structured observations, we were able to conduct risk factor analysis and understand the variables that may be risk factors for food contamination. The majority of our participants or caregivers were female, but the children were equally male and female, with the mean age of 34 months. 79% of households had basic drinking water service, and the study found that over 80% of water samples were contaminated with E. coli and total fecal coliforms. 77% of households reported open defecation, with 75% having limited hand washing facilities. So this meant they only had either water or soap, but they didn't have both of them. And 64% of households were exposed to animals, with the most common exposures being chickens, goats, sheep, and cattle. And 13% of households had animal feces present within the compound. So 43% of foods or child foods was contaminated with more than 0 E. coli per gram, and 90% of food was contaminated with more than 10 total fecal coliform per gram. So this was measured in coliform forming units. And hand washing was rarely observed, both through preparation, feeding, and also of the child's hands before feeding. Children are often fed on the ground, with feeding themselves by hand, and meals that were stored and then cooked were often not reheated, with 35% of reheated food not being done to boiling. On the right, you can see how the different food categories are contaminated with E. coli. And although we didn't find any significance between these different food categories, this graph shows that contamination was slightly higher when meat, fish, or milk, or fruit and vegetables were added to cereal-based foods. So moving on to the HACCP, we were able to produce this food flow diagram for the food categories, which looked at how the food was prepared, fed, and stored. And from this, we were able to identify 4 critical control points, which included handling. So that was handling of food when it was being prepared, as well as feeding and using utensils. The second critical control point was cooking and reheating. The third was animal exposure during food preparation, as well as feeding, and the last critical control point was storage. And we suggested to counteract these were hand washing throughout preparation and feeding practices, as well as using clean utensils, cooking all food to boiling, avoiding animal contact, and using covered containers, which hopefully would limit food contamination throughout the process. Moving on to the multivariable analysis, we found that child self-feeding and animal presence in the child feeding area were risk factors for E. coli contamination. And for total fecal coliform contamination, we found child feeding with a spoon was protective against contamination. So this study highlights how food is an important pathway for enteric disease, and is a major concern for children recovered from severe acute malnutrition in humanitarian settings. We found that food was contaminated with high levels of both E. coli and total fecal coliforms, which was in line with some other studies, but especially the total fecal coliforms was definitely higher. It helps to build our understanding of child food contamination. However, our risk factor analysis can't establish any causation of SAM or relapse, but it indicates possible risks for vulnerable groups. And we were able to identify child self-feeding and animal presence in the household were key risk factors. And further research would allow us to understand these risk factors, and also the critical control points, and if they were indeed actual risk factors. Also, further research would allow us to look into the implementation of the suggested control measures from the HACCP analysis. So that include hand washing with soap, cooking food thoroughly, reducing animal contact where the child feeds, and covering food could greatly reduce contamination, especially focusing on practices that involve the child, such as hand washing and using cutlery, may greatly improve or reduce food contamination within the household. And implementing these simple interventions may help to reduce the risk of relapse to severe acute malnutrition. Thank you so much for listening, and I look forward to any questions that you may have. And yes, thank you.